Still just $3.99. Fruit trees, blueberry $5.99, papaya $9.99, fig trees $29.99, and citrus just $59.99. All huge savings this week, so come out early for best selection at Bob Wine's Camellia Gardens on Southeast 38th Street, Ocala, daily till 4:30 in the same blooming place since 1952.
When it really counts, depend on the source for the latest weather updates, keeping you ahead of the storm. 96.3 FM, 1370 AM, The Source.
Today will be mostly cloudy and humid with a thunderstorm in spots this afternoon and a high of 87 to 91. Partly to mostly cloudy and humid this evening, low tonight 74 to 76. Then expect showers by tomorrow afternoon. Partly cloudy and humid otherwise, high Thursday 89 to 91. Friday, look for some sunshine, then turning cloudy and humid with a thunderstorm and a high of 88 to 91. From the Florida Weather Center, I'm Holly Holbrook.
WOCA. Ocala.
And welcome back to the show. You're listening to AIM Ocala Live, 96.3 FM, 1370 AM. Good morning. I'm your host, Adam Mikulin, as we welcome you this Wednesday, September 16th here as getting a little bit warmer, 78 degrees out there with overcast clouds. We can expect showers and thunderstorms this afternoon. Well, it's par for the course, though, isn't it? Moving on with the show here, as we were just discussing a little bit of what it meant with the idea of the theme parks and the masks and everything going on there and all of this that has carried through with the COVID-19 pandemic. Well, how about this? As we move on a little bit with topic, it's time to see your doctor. And why is that? Because people are delaying care out of fear of contracting COVID-19. They are dying at much higher rate from chronic conditions. Matter of fact, 12 times higher, according to the CDC, for conditions such as obesity, lung disease, diabetes, and heart disease. Whether or not we know that they're getting logged as a death from COVID-19, if all that is not what we're here to talk about. We're here to talk about how the medical service provider WellMed is partnering with United Healthcare to educate people how they can safely see their doctor with their conditions before they worsen and become deadly, so to speak. And the idea of this is we have on the phone Dr. Kenneth Adams. He's a Regional Chief Medical Officer for the United Healthcare Medicare and Retirement, as he collaborates with the hospital systems and physicians to ensure quality care as efficiency for United's healthcare medical and Medicare members. As we welcome him, Doctor, good morning.
Good morning. How are you this morning?
I'm doing very well, very well. As we welcome you to the show, and it's kind of interesting. It's just a lot that we know has gone on in this year already, and boy, I just preface every interview like that. But this one, as we're keeping the listeners informed, it's there to know that a lot of people who have pre-existing conditions, outside of what that means for getting COVID-19, we're just talking about the idea that if people who have pre-existing conditions who are a little bit threatened by COVID-19 are delaying their care out of fear of contracting COVID-19, which means they're putting off seeing their doctor.
That's happening everywhere across the United States right now, and it's really scary to watch as members who have pre-existing conditions like obesity and lung disease and cardiac disease are staying home because they're afraid of going to their physician's office. They're afraid of leaving their house. And the reality is those diseases they're not taking time off because of COVID. They're still progressing. And the symptoms that people are having, they're putting off going to see their doctor and winding up in the ER. And 12 times as many people with those chronic conditions are dying right now. So you need to get in to see your primary care physician.
And that's an incredible number. I wouldn't expect that, as you mentioned, 12 times. It's 12 times higher, according to the CDC, for conditions such as obesity, lung disease, diabetes, and heart disease. And, what advice do you have for folks that may be very, very timid in regards to how much they've heard in the media, obviously with pre-existing conditions, but to still get out there and get the care they need dealing with their pre-existing conditions?
I think the biggest thing thing that a patient can do right now is actually communicate with their physician's office and see what options the physician's office has for them. Most physicians' offices now are offering televisits, which are a great way to interact with the physician or a care practitioner within their clinic and find out if you really do need to come in person. Sometimes there are a lot of things that can be done online that don't need you to actually drive to a clinic and pay for parking and sit in a doctor's office. They can actually be done online. It's really convenient. So that's the first place I'd start. But if the physician doesn't have telemedicine options, some clinics are offering curbside visits where a nurse will come out to your car after you call them when you arrive, check you in, and then the physician can actually come out to your car and see you there. So there are a multitude of different options for you to go see your physician, as well as the fact that physicians are taking strict precautions, cleaning their offices, requiring masks, social distancing within those offices to make you feel more comfortable coming in to see your physician.
When you have conversations with... Gesundheit. As you have conversations with patients and everything, what is it that you can do to console them in the idea of knowing that even if the doctor's office have strict guidelines and phases and all this stuff to implement to make things better, what do you do to comfort them a little bit, to let them be aware that it's still reasonable and safe to try to do what you need to do to get out there and see your doctor?
Well, I think first off, masks really do work. I mean, surgeons use them in operating rooms. They've had years and years of data showing that they do work. So going out in public when you wear a mask reduces your risks of getting COVID. So when you couple that with going to a physician's office that is using strict guidelines, the likelihood of you contracting this aerosolized disease is diminished. First off, I'll reiterate, I think that communicating with your physician's office via telemedicine is the first place that I would start and go from there.
Mm-hmm, mm-hmm, absolutely. Doctor, let me ask you, I know it's prepped here for me with the idea of certain ideas moving ourselves into the fall. For example, they say doctors also advise you to not miss out on such things like flu shots and recommended routine screenings and immunizations. And I was going to ask you, leading into this, fall season here, we know that there's an expectation of cooler weather that changes the degree of people out and about and staying in more and everything else. What can you do to say about what's next for the rest of the year when it comes to not only those with pre-existing conditions to maybe like we said, see their healthcare provider, but what do you think about with COVID-19 as far as what the rest of the year has in store?
Well, I would say that it is definitely possible to get both the flu and COVID-19. So eliminate the flu, go get your flu shot. And then as far as COVID-19 for the rest of the year, I think and I hope that people continue to wear masks and continue to social distance. I think that has definitely been proven to have brought down the positivity rates, and we're beginning to see potentially a light at the end of the tunnel. So I hope that continues. You do point out a very good issue that as temperatures decrease, people tend to spend more time indoors. And being indoors is probably the most likely place to contract COVID, especially in small offices where the air is not circulating well. So I would encourage people, if they're in an office where a window can open, to periodically open that and to let the air circulate through there. HEPA filters in your room can increase the turnover of the air within your room. Running it through a filter that's a 12 or 13 would be beneficial. And then obviously wearing a mask. Mm-hmm. Those are the things that I would recommend.
Absolutely. Is there a place to go where listeners can go for a little bit more information about what we've been discussing today?
Absolutely. wellmedhealthcare.com/see your doctor.
Excellent. Excellent. Well, thank you for taking the time today, Doctor. As we mentioned, I just think that's a lot of vital information to let people know that outside of COVID, there is still a lot with, like we said, with the numbers according to the CDC conditions, with already those pre-existing conditions and having those taken care of. So thanks for bringing that to a little bit more light. We appreciate it.
Thank you. Have a great day.
You got it. More AM Ocala Live coming your way back after this.
Shut down. Police are asking people, do not go outside and assess the